Hello, and thank you for joining us on the latest episode of Reimagined in America. I'm Karobi Acharya, and I lead the Global Ideas for U.S. Solutions team here at the Robert Wood Johnson Foundation. I'm really excited for today's webinar, and I'm eager to dig into our conversation about social isolation. And just as a note, we have broken a record with over 950 people registered for this webinar. Before we dig into the conversation, just a quick reminder that everyone's audio has been muted, but you can ask questions at any time using the Q&A button on the bottom of your screen. And also note that we are recording the webinar and we'll be sending it to you and anyone else who's registered. But I want to start by learning a little more about all of you. So we have two questions for you, which should appear on your screen now. And please just click on your answers. So the first question, if you know someone that has experienced social isolation, who are they? And just check all that apply on that drop-down list. Okay, and then the second question, give people a minute, but the second question is, why did you join today's webinar? You might have to scroll down to see that second question. And that's also choose all that apply. All right, last chance to get your answers in. I'm just waiting for the responses to come in. All right, let's see. All right, so really interesting to see. A real mix of 78% talk about knowing an elderly person who's experienced social isolation, but you can see that, you know, this is not limited to the elderly. This is new parents, teenagers. I mean, really, there's no category that's less than 20%, which is pretty remarkable. Obviously, people experiencing illness, whether physical or mental, people who are unemployed, 39%. And then in terms of why you joined today's webinar, 59% want to learn about social isolation, but I love this. 81% of you are looking for solutions that you can bring to your own community, and that is fantastic. That is exactly what this is all about. So you are in great company, and we've got two terrific speakers who are tackling this issue head on. So, you know, we tend to think about social isolation as something that people experience as they get older, but as we just saw in that poll, social isolation can affect anyone at any time. I've seen it in my own community, and it's a trend that's plaguing countries around the world. And as you may know, social isolation has significant effects on our health, causing stress and a lack of sleep, but even putting people at higher risk for coronary heart disease and strokes. As a foundation that's learning from around the world, we looked abroad for inspiration for how to tackle this emerging health problem. And we found some really incredible programs that are changing people's lives, helping them to feel more connected and like they belong. And earlier this year, we've invested in bringing 6 of these solutions to the US. And today, I'm excited for our conversation with these two wonderful leaders who are bringing some of these global ideas to their communities. So let me introduce them now. Oswaldo Mestre is the Director of Citizen Services for the City of Buffalo. And in this capacity, he works with residents, block clubs, and organizations to better service the community. This includes programs aimed at supporting the rejuvenation of inner city neighborhoods and efforts like the Open Data Buffalo initiative, which has made a broad range of city data available to residents and has provided residents with training on how to use that data in community projects. Through the Winter Mission Project, Buffalo has been learning from Canada and Scandinavia about approaches to reduce social isolation in winter. Stephanie Allen is the Executive Director of United Way Mat-Su. She leads the organization in its efforts to improve education, financial stability, and health for all in South Central Alaska. Stephanie was instrumental in establishing Youth 360, which is an initiative that connects local youth to their peers, parents, and community to improve their health and well-being. It's adapted from an Icelandic model and is currently being piloted in 2 communities in the Mat-Su Valley. So 2 wonderful speakers. I can't wait to hear from you both. And I'm going to kick things off by asking Stephanie and Oz a few questions, and then I'm going to turn it over to you, our audience, to ask questions through that Q&A button. So let's get started. So Oz and Stephanie, I wanted to start by asking you both, what does social isolation look like in your community? As we saw, it's not limited to the elderly. What are you seeing in Buffalo and Anchorage? Oz, do you want to start with that?
Well, thank you very much. I think the idea of social isolation affects different communities differently. As you can tell, in Buffalo, we are called the snow capital of the world, but we are not. We deal with isolation in different ways. Weather affects residents in our community, but community does too. People who feel that they are by themselves, or people who in our communities who self-segregate, our immigrant and our refugee population who come to Buffalo and tend not to necessarily connect as best. It also affects in an urban community as well, because those who have scarce resources are not able to participate in doing public transportation or in public services as well, and they're not as connected as well. So we see in Buffalo, as we look at not just the weather, but we look at other services, how that will affect residents. We are a city of good neighbors, where we tend to work and hand in hand. And when people are isolated themselves as a community, as smaller communities, it really affects the fabric of how we can deliver services.
Great, thank you. Stephanie, what does it look like in Anchorage and in the Mat-Su Valley?
Well, Alaska is very independent and is considered a frontier community and a frontier state. And so people really crave space and land. And on one hand, excuse me, one hand, that's a great thing. And to have, you know, all this open land to run and to play and to experience the great outdoors. But inevitably, it leads to us, because we've created and have such a yearning and desire for so much land and space, we are very geographically isolated from one another and are far removed from one another. Neighborhoods in the main core area of the valley do exist, but by large, the essence of the Mat-Su borough is not neighborhoods and communities that are very far apart from one another, neighbors, or it might be a mile or 2 away from one another. And winter also does contribute to social isolation in our area, obviously, too. And people tend to stay inside and hibernate, if you will, and not connect. This picture that you see in front of you is an example. This is a student riding the school bus. Our school rides for students to get home to and from school range, 30 minutes up to an hour and a half for a lot of kids in our community. And just a representation of the actual geographical pieces that we are, so removed from one another, and then that contributes to us also not being connected on a one-to-one human basis, a social basis, being connected.
Yeah, wow, that's a long bus ride. So, Stephanie, you've taken a youth prevention program that has dramatically reduced smoking, drinking, and drug use among teens in Iceland, and you're rolling it out in the Matsu borough of Alaska. And what I love about this program is that it's very different from traditional prevention programs, which often tend to just tell kids about the dangers of drinking and taking drugs. This program really gets to the root of it by creating ways for teens to spend more time with friends and family and to help them feel like they belong, and also getting parents more involved with their kids' lives. And in fact, in Iceland, it's been credited with transforming family life and changing the way kids are raised. So I wondered, how did you come across this program in the first place, and what was it about that caught your imagination?
In 2017, at the end of the year, an article came out, and you can see that down that bottom left-hand side, how Iceland got teens to say no to drugs, and it just went viral across Alaska. And I even had some peers across the nation express, people were sharing it and talking about it, and it's like, what is going on in Iceland that they're having so much success, and how can we replicate this and understand and adapt this to Alaska? You see on the right-hand side, this is a picture of downtown Reykjavik in the late 90s, just full of teenagers. Teenagers at the time were considered to be adults, and they were seeing astronomical rates of alcohol use and drug use, theft, those types of things. And residents in Iceland didn't feel safe and really came together and said, what can we do about this? Through our learning, we were able to, then you can see the graphs at the top there demonstrating drinking and smoking and using narcotics as well as marijuana use, and see the huge, dramatic, significant reductions in those. Looking at alcohol use going from 42% in, of kids being drunk in the last 30 days, down to 5%, which is quite significant and a success. What they what they did is they took the data to the people. They said, what is going on in our community to help us understand and to look at the environment of their children and their youth. They said, surely nobody goes out to, intends on being drunk all the time, right? It's making this choice per se, but it's not about bad kids making bad choices. It's the environment that is shaping our kids that then puts them in this context that this behavior is happening. And so they did a very robust data study, and they continue to do it in an annual basis, which is a big component of this project, is to have frequent, reliable data that they're able to go back to the communities, and the communities are engaged, and they see that this is our data, our kids. This is something that is meaningful to us and that we want to change. And through this process, they were able to, at the time, and continue to do that now 20 years later, have the data really inform their work. They check in on their strategies that they develop. They check in on policy and budgets. Everything is through the lens of what does it take in our community to have the infrastructure in place to have youth and families thrive. You mentioned families, Krabi, and families came out in force when they looked at this, and they had been living it, right? It wasn't just the data. It was part of their culture, and parents took a pledge to have dinner together and to check on one another. They really changed the culture in Iceland to back to that it takes a village concept, that all of our kids are all of our kids, right? And that they would go and walk through the neighborhoods and walk through blocks in Iceland and really check on kids, see how kids were doing, and not more of a, hey, you're supposed to be home and what are you up to? Do you need anything and are you okay and can I help you? Workplaces changed in Iceland. They were really considered to be workaholics, which is a similarity I believe exists here in our country too. Families didn't come home for dinner time, and kids were out and about after school. They didn't have any type of activities to choose from. They were unsupervised. There was unstructured time that existed at the time. They also changed policy. The age of maturity was 16 in Iceland at the time, back when this very first started, and then it did move until 18, and so that changed things of the norm. Not only that these are still kids, but that they have access to services. They're still in school, that they're still developing their brains and their bodies. And then things that, it's really interesting too to look back and see about how they implemented this model, is that, and talk about how integrated it is. It goes all the way from their daycare settings to the city municipality shaping policy. They have designated personnel for primary prevention. They've really looked at it from the grassroots level all the way to the grass tops level, and is full integration. Thank you for advancing this to the next slide here. And so they did realize through the data analysis, in looking at the kids that weren't drinking or smoking or doing drugs, and the kids that really felt connected were kids that were involved in leisure time activities, that had opportunities within their peer group to connect and belong, have trusting relationships with their peers. Back to leisure time, that that they had safe and healthy places to spend their time and to engage with one another, and different opportunities. From the family component, they had a big push to really raise the level of awareness and knowledge about the importance of youth development and well-being. No family set out to be, families always put their kids first, right? No matter what is going on, even in unstable homes. So it's about what can we do to prioritize that and understand through knowledge and awareness what's happening with youth development. Of course, the connection and communication at the community level, or I'm sorry, at the family level, and then between families. So not only within the primary family unit, but one family then knowing another family, and knowing your children's friends and your children's friends' parents. And then embracing schools as the hub for communities to provide opportunities for health, for well-being, and really enhancing and growing and strengthening the capacity of schools to improve that well-being.
Right, right. Wow. Well, yeah. Well, it's a tremendous program. Oz, I wanted to turn to you now. I love how you mentioned this before, how Buffalo is known as the city of good neighbors. That if your car breaks down in the middle of the street, the person behind you will stop, jump out, and run to your aid. And it seems to me that that's what you're doing with the Winter Mission program, is really making sure that this motto lives on through the cold, dark months of winter. So I'd love for you to tell us about how you're turning public spaces into places to gather and socialize during the cold months, and how you're strengthening the city's social fabric at a time when most people shut themselves indoors until the ice thaws. And if you could also tell us a little bit about where you've learned some of these ideas from.
Well, great. Thank you. Buffalo is known as obviously the city of good neighbors, and one of the things that we did with this is that we worked with an organization called 8 in 80 Cities. It's an organization out of Toronto who worked with the Robert Wood Johnson Foundation, and thought it saw fit that their organization looks at the view of a city, that from a young person from age 8 to age 80, and how would they look at a city, and how would they connect and work and see that. And so we worked very closely with them, 2 other cities, Buffalo, Eau Claire, Wisconsin, and Leadville, Colorado, to put together a pilot program really about engaging residents in the community, but to come up with a pilot program that folks can embrace, and looking at winter, but looking at it and looking at our public spaces, but looking at our communities and how we embrace winter. Obviously, Buffalo, what we have learned and what we do is we are a full season city, right? 4 seasons. We don't just take off on winter. We're learning to embrace it and understand it a little more. And so throughout all of that, that engagement, what we did is we worked again with community, and we did over 600 engaged people. We did 32 community pop-up and workshops. And then we really engaged community to find information about pieces of feedback. And what we found out from that engagement, as we listened to people coming up with an opportunity, was that along those lines, there were a theme, there were constant themes that came in terms of understanding what we were doing. And some of those constant themes were winter snow clearance, talking about winter warmth, talking about winter programming and winter inclusivity. And each one of them was a very, very specific theme in terms of understanding more about the city of Buffalo. We see and understand about snow, we understand that, but what do we do and how do we understand what happens in different communities, in different neighborhoods? We understood that accessibility and issues of social cohesion and also intergeneration volunteer. As we looked at engagement, we said, well, what kind of mechanism, what can we do? You know, we didn't want to have the heavy hand of government saying that this is what we wanted to do. What we found out as we engaged with our partners, Go Bike Buffalo, the Buffalo Wellness Institute, and block clubs, we found out as we engaged, we found out that we, in our social fabric, we had over 600 block clubs and neighborhood watch organizations. And so that's not to be ignored. And what we find out within those particular communities, you have residents who are volunteering, who are meeting, who are talking about community problems within their own neighborhoods. And so as we teased this out and talked with them, we said we were going to do mini grants, mini winter mission mini grants to go to the communities, again, to talk about issues of accessibility, social cohesion, and a generational volunteer, and then let them come up with their particular plan. And so we have AmeriCorps Vistas, who are engagement specialists, where we go into communities and work with those particular residents with the mini grants, doing workshops, helping them put it together, but also what is the plan? As they meet and come up with the plan, again, we ask them to focus on their most vulnerable, doing check-ins, talking about accessibility in terms of sidewalk clearance, snow clearance, and also making sure that they're engaging young as well as old in the community in doing that. Along the way, we found that the inclusivity, which is the idea of working together, we are sponsoring for them to do a mid-city, a winter bash within their own community. So, you know, Buffalo in the summertime and the springtime, we're known for doing festivals and going out and just having a good time. Again, embracing the winter and understanding about each particular community, instead of people staying inside, having them work together and contributing to the social cohesion of a particular neighborhood, which helps the community itself. And so as we're doing this, we're going down a few particular themes in terms of this understanding about, again, snow clearance, taking care of the winter warmth. The other project that we're working on too is a handbook. And it's something that we picked up for one of the Canadian cities in terms of there's so many different activities that are happening within the city and how some pockets of communities will not know. And so we said, let's put all of that in one document, or let's share that with everyone to understand that how communities can not only go to the big picture events, but to some of the smaller community events that are happening in the communities, because communities kind of tend to self-segregate, but also not in the worst way, but in the best way. How we eat, how we look, how we eat, worship, all of those particular things, again, happens in the wintertime as well as it happens in spring and summer. And so those are some of the particular things in terms of working, doing the mini grant, processing that, working together with our particular theme, having, again, our engagement specialist, which is our AmeriCorps Vistas, going into the communities, helping communities come up with that. And it's really just been a pleasant surprise. It's been well received. Again, working within the fabric of a Buffalo, right, a city. If we're known as that can-do city you talked about, you know, when it snows, we help people out, and everyone keeps a snow shovel in their car, and you know, we don't even wait for a thank you because we just want to pay it forward. And so we built upon that because we knew people were doing that, and so providing monetary dollars for that.
Wow. You know, what strikes me in both of these examples is how some of the solutions are really quite simple, right? Like clearing snow or being home for dinner. They're not terribly complicated solutions, and yet they can make huge differences. So I'm going to go to the audience now. Okay, good. So please, if you're in the audience and have a question, please enter your questions in the Q&A button. Press that Q&A button and enter your question. We're going to try to get to as many as we possibly can. Let's see. So Oz, here's a question for you. Can you speak a bit more about the winter warmth element of the community priorities? What were some of the activities specifically?
The winter warmth activities were to identify those public spaces within those particular communities, community centers, parks, and really identify those areas so that they can be meeting points and do activities within those communities. And so in Buffalo, not just the big parks, but some of the smaller pocket parks, or those organizations that are meeting and creating that particular space. So again, not looking at our parks as, you know, doing activities during spring and fall and summer, but winter activities happening. So, you know, the lights are not out and doors not shut out, but what can we do to activate those particular spaces that are in those communities, community centers, and look at that in terms of winter activities. So that's providing that particular activity.
Great, thank you. So here's a question for both of you, and Stephanie, maybe if you want to go first. How are your cities measuring if programs have moved the needle on social isolation? Just thinking about, you know, how hard it might be to operationalize that concept into a metric.
We are measuring at the program level. Within the club structure, just real quick, we have implemented after-school opportunities for kids and having daily structured youth clubs available. Transportation home, food, on-site behavioral health happening at the schools in partnership with our local health foundation too. And so these wraparound services. But we are measuring connection and social isolation within the program itself, and our students that are involved in the program, as well as youth voice, which is a big component of this project and initiative, is that they have a say-so and that they have the ideas and solutions for themselves and the community, and lifting them up and kind of honoring them, putting them first in this process. We are measuring that at the community level and with families too. We have embraced this component as far as the data goes, specific to this question, around more frequent data collection and immediate reporting back to kids themselves, schools, and local families and our community leaders, so that they can be, you know, obviously part of the solution. They're so integral for the success of that. And I'd be happy to share, and I know this is being recorded, our survey that was developed, and you know, some other corresponding like logic models and evaluation plans with everybody too. I know we're kind of short on time, but there's a wealth of indicators that we've brought in with the Youth Risk Behavior Survey, School Climate and Connectedness Survey, and the Icelandic Prevention Model Well-Being Survey that we're utilizing.
Oh, that's great. That's great. Oz, anything you want to add about how you're measuring social isolation?
What we have done when we've looked at those areas, we were not afraid to pinpoint areas that are most vulnerable in the community. And I probably have, you know, lessons learned and understanding that, you know, we did open this up to the city, but we specifically targeted certain communities that we thought, some communities that were pockets, not necessarily high in poverty, but where there were no parks at, where there were folks are not connected to public spaces. So how we are measuring this here is the engagement of residents. So block clubs engaging other people, looking at the numbers of what we're doing in terms of that, and monitoring that aspect of that too. So our numbers on our data we use to kind of identify areas that were pockets, so that we wanted to make sure equity played a strong role in terms of understanding the communities that we're going to be able to serve too. Because obviously when we talk about social isolation, those who have will do in the winter, those who don't, there's some more challenges that they have as well in terms of just getting to other areas, understanding about the choices that they make in terms of engagement. We all understand about engagement in self and families that needs to happen, how we connect to other people, to our seniors. That intergenerational approach is very, very important.
Great. So here's another question that is for both of you, which is really about resources. There have been a couple questions around this. You know, many places, particularly in rural parts of the country, don't have a lot of resources for things like clearing snow or creating spaces for young people to gather. What suggestions would both of you, would each of you have around, you know, how places with scarce resources can still make progress around social isolation?
Great question. Great question. In Buffalo, what we did is we built upon the fabric of what was already happening. So in these mini grants, or what we're doing is that we understood that folks were doing that. They were shoveling, or they were using their snow blowers. And so the opportunity to engage a young person and give them a stipend to engage, or to say, hey, you know what? At the end of the snow season, why don't you go down the whole street and I'll give you a gas cart. These are not very expensive opportunities for engagement to entice folks to do something that they're already doing. And maybe, you know what, they're not necessarily doing it because of scarcity of resources. So what I would say here is understand what's already working, put the carrot in front, the encourage. Folks will tell you, because we told you about the number engagement that we had. We thought it was about recreational opportunities. Folks came back in Buffalo and said, you know what, clear the snow, right? You know, we thought that it was even some other things. People like, yeah, we do want some activities for seniors. So listening to what people have to say is very, very important, but building upon what was already there and what was already happening, and then enticing folks, having them come up with their own plan, but also providing resources. So if it's not money, from the city perspective, we have AmeriCorps Vistas who do engagement, and so they're there. And we've learned that actually looking at the city of Edmonton and what they were doing and how cities in Canada embraced winter, right? And you know, and that that's one of probably the biggest lessons that we learned from our Canadian cities in terms of understanding how they didn't run away from it; they embraced it as a part of their fabric. People, they work, worship, play, study. It's all about understanding that this is part. Seasonal aspects of what's happening in the city is a part of what makes up a city. Even to the point where, as we are looking at our data and our information from our winter mission engagement, every city has a master plan in some type of way. When you looked at the city of Buffalo's master plan, it was some great stuff, but had little and talked a little bit about any winter activities. And so the great thing about this engagement, now the city is doing a reevaluation of all of our open park spaces, and our engagement is going to be part of that master plan. And so sometimes it's not about what's happening today, but what's embedded in terms of the culture of what's happening in the city, how you can be able to change it.
Great, thank you. Yeah, really interesting. Stephanie, anything you want to add on that?
I was totally shaking my head, excuse me, listening to Oz. You know, one of the things just to add is building on the capacity that already exists in the community, I think was big for us, and kind of honoring the champions that already exist, that are out there for kids in our neighborhoods, and the communities that are far removed from one another. Embracing too what exists as far as what people can give, kind of meeting people where they are when it comes to resources. So time, facilities being donated if possible, human resources that can come to the table that people can volunteer and provide some in-kind support of, technology resources too. But I think really, the champions piece is big for us, and that it took a while for us to build readiness in our community to be able to move forward on this project. And that is part of building those resources too, is kind of having that foundation of readiness and capacity to be able to implement something.
Right. So here's a question that I think is probably on a lot of people's minds, which is around social media. How do we combat the impacts of social media, as the perception is, of course, that it's connecting people, but we know that in many cases it's actually making people feel even more isolated. And I'm wondering if that has come up in either of your work, and how you're addressing that.
This is Stephanie. I'll go first on that.
Sure.
Yes, social media is, a big component, obviously, of all ages of our lives now. And for kids, how they're connecting is primarily through social media outside of the school environment, and adults too, to be honest. And I think we're seeing that, across the U.S., but across the world, honestly. In that we're connecting, via digital ways and only putting kind of our, what we're putting out on social media is maybe only a glimpse of the positive, and it doesn't, demonstrate, who we are from a genuine standpoint if we're having a tough day, or if something, is doesn't go our way. So I think, even in Iceland, they've been talking about this too, that they've had increased rates of anxiety related to social media. I see it really as both an opportunity and a way to get back to our roots. So an opportunity within social media is ways to connect, to build up, spread the word about great opportunities, or ways to, to put your phone down, or get off the gaming system or something and go and just play and be together and enjoy one another's company, learn from one another, be with different people from different generations and different backgrounds and experiences, and that's fun, and there's enjoyment to that, and great benefit to that. And also just to really, not only embrace it as far as kind of spreading the word, but then getting back to our roots about that we are, humans by nature really crave social interaction, and it is critical to our health and well-being. And I know it's hard to put that in the kind of like from a science perspective, but it's shaping kind of from a communications and engagement strategy, to just have people honor what we know already, and that is, getting back to our roots, is that we crave to be connected to one another. And so finding those ways to just naturally do that, and to just get out and meet your neighbor, or to walk across somebody, in the grocery store, and spark up a conversation, or just smile and meet people directly, look people in the eye, and connect with people one-on-one as much as possible.
Yeah, I love that. Oz, anything you wanted to add around social media?
Well, no, I think she said it well. It's one of the things that we touched on when we were putting together and crafting these opportunities within the smaller neighborhoods. We saw, obviously there's a generational gap in terms of how folks consume social media, and we wanted to ensure that there was this opportunity where young and old were working together. And I think the activity to embrace outside activity. To be quite honest, when I'm out shoveling, my phone doesn't work anyway because it's too cold, right? And so I think that's probably a good thing. But to understand and be able to try to use it as a tool as well. And so we're trying to embrace that. But just to get back to our roots, to engage, we in Buffalo, we have the saying, it's engagement, but then it's also learning from those particular engagements.
Right. So I'm afraid we've got time for one last question, and if I could ask you both to be brief, but this is around the word, the term or the phrase social isolation. I was really struck as we got into this work, that different groups seem to use different words depending on the population they're working with. So people talk about disconnected youth, or they talk about inclusion with immigrants, or social isolation with other groups. I'm wondering, in your communities, is social isolation a phrase that is used? Does it resonate with people? Or are people using terms instead like belonging and connection? Are those perhaps more resonant terms? I'm curious about the language that is resonating with people.
Well, I can add, when you hear
Sure.
the word social isolation, it's a very powerful, one way or another, issue of being isolated and social. I think other phrases is, I think things are happening in those communities and how communities self-identify what's happening. It's incumbent upon us, working in government, working within the Division of Citizen Services, and working very closely with the mayor, how we look at those particular communities and how we understand how they will tend to work, right? And how they will look at it. And for us in Buffalo, we looked at neighborhoods and we looked at individuals who were doing things in neighborhoods. We looked at our most vulnerables. We looked at our refugee and immigrant population. We looked at areas where there were the propensity of more youth. We also looked at areas, again, where public transportation was an issue, right? And so what we heard from folks in the community, let's clear the sidewalks so folks can get to and back and from to work. And then what we said, well, let's work with you to do that. Have you identify what those things are as well. So when you hear about, those phrases or that is good, you say that, it brings some awareness, but it's more important for folks to tell us and for them to self-identify what those particular issues is and for us to listen to what that area is. And I think you're right. In every different community, it means something a little bit different. Here we're talking about weather. Here we're talking about activities, but when we're talking about groups of people, when we're talking about issues that affect individuals all across the way, isolation is isolation, and it is not necessarily the best thing in the world to happen in terms of when we are talking about this embracing community, and that's a whole nother conversation in America.
Right. Stephanie, just very quickly, tell us your sense of the phrase social isolation and what it means in your community.
Very interesting question. I think, to speak about social isolation, there's more of a connection with that phrase to negative types of behavior, I would say. So people talk about isolation more when they're talking about things like suicide and addiction, abuse, whether it's child abuse, neglect, or domestic violence, ACEs, those types of things. I was just, as you were asking that, I'm like, wow, what an interesting question, and then talking about the positive things and the things that we need to thrive and be healthy and to develop to our potential are, those protective factors of social opportunities and connection and belonging. And so, it's my kind of really feeling that at the community level, we tend to separate out those two based on kind of the negative either behaviors or the negative types of issues that we have in our community, tend to really couple that with isolation, whereas the positive piece and talking about well-being and health, we tend to flip to the other more positive in nature type of phrases like belonging and connection and social opportunities.
Right. Wow. Well, I wish we had more time. We still have so many questions in the queue, and unfortunately, we're not going to be able to get to them. But I wanted to thank Stephanie and Oz for speaking with us today, and I really wanted to thank everyone who joined us today. Today's conversation, and particularly just the numbers of people and interest in this topic, has really given me hope that we can really start to reverse the trend around social isolation and the toll that it takes on people's mental and physical health. As we've said, from first-time mothers to immigrants to young people, we can find ways to find opportunities for people from all walks of life to find the social connections that they need to help them thrive. So I hope you've come away from today's conversation inspired and perhaps with some ideas of how to get started in your community. Thanksgiving is next week. It's a perfect time to reach out to people and help us all get socially connected. As soon as we're done, a very short survey is going to pop up on your screen. Please just take a moment to fill it out. Let us know what you thought of the webinar, and watch out for an email with the recording of today's discussion. Please share it far and wide. And with that, thanks again to Stephanie and Oz and to everyone who joined us today. And I hope to see you on our next Reimagined in America webinar. Please fill out the survey and have a great rest of your day.